Toothpaste, toothbrushes, mouthwashes and whiteners. Are they doing us more harm than good? Could mouthwashes be a recipe for cancer? Does whitening damage our teeth? And are we poisoning our children with too much fluoride? What's really in my toothpaste? Every year we spend millions on a huge range of oral care products that claim to fix all kinds of problems. But do I need them all? Can they do what they claim? And what's in them? I want to find out what will work best for me and my family. I'm starting my investigation at the beginning with the toothbrush. Electric or manual, soft, medium or hard bristle, flexible head or tongue brush, which one do I choose? There are 3 types of manual toothbrush heads: flat head, V-shaped and staged. And then of course there's electric. We want to find out if any of these heads can give our teeth a better clean. Oratia District Primary have a class of 10-year-olds that have volunteered for the job. But before we let them loose on the toothbrushes, we asked dental nurse Toma Cullum to brush them up on their cleaning technique.
What you've got to do is put the bristles at a 45-degree angle like that.
Yep, there's a new brushing method to learn, the Bass technique. Short, vibrating strokes are in.
Do you think you'd be able to do that? Yeah?
So that we could see how well these brushes performed, we got the kids to rinse with some colourful disclosing solution. The bits that are stained red are covered with decay-causing plaque. We put 5 kids on each brush type and set them to it. The toothbrush that gets rid of the most red will be the champion. It was all a bit exciting, and in their enthusiasm, some may have forgotten the finer points of the Bass brushing technique. So, which brush head gave us the best clean? Flat head, staged, V-shape, electric? Let's see that again. Well, we couldn't see any difference at all. What about our dental nurse?
I don't think there was any toothbrush that was better than the other. It's just the way they get used.
Okay, so the results of our test were pretty inconclusive. But what about dental professionals? What toothbrush would they recommend?
For me personally, the best toothbrush is a soft nylon bristle brush that's on sale.
Dr. Jonathan Lecter has been a dentist for 30 years and now teaches dentistry at the University of Otago.
We want to use a soft toothbrush because a soft toothbrush can bend and they can contour to all of the different shapes and crevices that we have in our mouth.
So that's the brush sorted, soft. But what about the toothpaste? What ingredients are lurking in that minty fresh paste?
One of the components in toothpaste is a soap-like material which helps make plaque removal easier.
These are called surfactants and help to loosen and clean off the plaque. The most common is sodium lauryl sulfate, or SLS. The good news is this infamous chemical isn't implicated in cancer. The bad news is that several studies have concluded that sodium lauryl sulfate could cause irritation to mouth tissues, and for those people prone to mouth ulcers could increase the incidence of ulceration. If you're worried, you could always choose a paste that contains the surfactant cocamidopropyl betaine, which doesn't seem to have the same irritating effect. So other than these surfactants, what else is in toothpaste? Mild abrasives like silica and sodium bicarbonate are also included to help scrub away the nasties. But are they also scrubbing away my tooth?
They are not going to cause damage to your tooth when used properly. In fact, using a hard bristled toothbrush would be much more abrasive and much more detrimental.
Toothpaste also contain humectants, which help keep the paste moist. Colouring agents are added. Minty flavours and non-sugar sweeteners cover up any bitter tastes. Then there are thickeners that help keep this concoction stuck together. But all of this just helps us expose our teeth to one extra special ingredient.
The application of fluoride onto the tooth surface is the most important single measure we can do to prevent decay.
When we lose tooth enamel to decay, our body will naturally try and repair the damage by combining calcium and phosphate in our saliva to create more enamel. However, if fluoride is present, it also combines with these minerals to form an even stronger enamel. The longer the fluoride is on your teeth, the better.
So our recommendation for patients is that they spit out the excess toothpaste, but they do not rinse.
But can we get too much of a good thing? Could fluoride be harming us?
There is no doubt that ingested in large amounts, fluoride is a poison. In fact, the consumption of one tube could be highly toxic to a 4-year-old and potentially fatal.
Fluoride, used inappropriately, used in the wrong amounts, is dangerous. But that's not how we use it in the fluoride of our toothpaste.
However, we did find one issue: fluorosis. When the adult teeth are forming in children under 6, fluoride can be incorporated into the enamel. A little makes the teeth stronger, but
if too much fluoride is incorporated into the enamel, we can end up with unsightly looking teeth.
this is fluorosis. It only affects the look of the teeth, but the discoloration will be there for life. So how can we ensure our children aren't affected? Paediatric dentist Dr. Bernadette Drummond has studied the occurrence of fluorosis extensively.
The cases I've seen have been children who've deliberately eaten toothpaste. So they've actually put it, exactly.
So how much would a child have to eat to be at risk?
A young child under the age of 3 would need to eat the equivalent of a whole toothbrush covered in toothpaste every day.
As long as they spit out their toothpaste, they will be getting the fluoride exactly where they need it, on their teeth and not in their bellies.
You need to be in control of the toothpaste, and you need to just put a smear on the brush for your 3-year-old.
And from the age of 6, they can move up to a pea-sized blob. That's according to the 2009 Guidelines into Fluoride by the Ministry of Health. The report also suggested that a lower strength fluoride toothpaste for children isn't always the perfect solution, as less fluoride means less protection.
For most children, unless you get advised differently by your dentist or dental therapist, you should be using a regular level fluoride toothpaste.
So what is a regular level when it comes to fluoride in toothpaste? Ministry of Health report clearly recommends toothpaste containing at least 1,000 parts per million of fluoride, but you won't find that on the label. If your toothpaste contains 0.22% or more of sodium fluoride or 0.76% of sodium monofluorophosphate, then you've got the right amount. Don't worry, the Ministry of Health thinks it's all a bit confusing as well, and labelling requirements are currently being reviewed. Coming up, we discover how harmful drinks like wine can be.
This looks terrible.
Yeah, it does.
Find out what's put in teeth whitening products and whether they cause us any harm.
Hi. Nice meeting you. Nice teeth, actually.
I've found out what's in my toothpaste and which is the best type of toothbrush, but what about the products we use to improve the look of our teeth? Teeth whitening. It's taken a firm hold on our pockets in the last few years, but there are so many products that promise to brighten our not-so-pearly whites. Can they deliver? This charming team of Vodafone salesmen are going to put whitening to the test. For these boys, a brighter smile could even improve sales.
It really is that cheap.
So who better to find out which over-the-counter teeth whitener will work the best? To help, we've enlisted cosmetic dentistry whiz kid Dr. Clarence Tam.
I'm going to get you to give me the biggest smile that you can. Okay, smile big and wide for me, and I'm going to see where you are on the shade guide here.
He's assessing each of the guys by using a visual test and a flash machine to establish the current colour of everyone's teeth.
Hi, I'm Dr. Clarence Tam. Hi, nice meeting you. Nice teeth, actually. If you could please take those out for me, that'd be greatly appreciated. Thank you.
Each of the 7 boys has an over-the-counter whitening product. 5 of the products are peroxide-based. Carl will be clamping down on the bedazzled, custom-fitted mouthpiece. Gary is using Pearl Drop's whitening wand. Jason, the Clever White ready-to-use tray. Carlson is using the Listerine whitening mouthwash. And Braden, the Pure White whitening strips. But 2 products don't contain peroxide and are relying on tiny abrasive particles to scrub the stains off. the extra white gum being chewed by Sid, and Darren is brushing with the whitening toothpaste. We'll leave them to paint, stick, chew and brush their way to a brighter smile and see them in 2 weeks' time. In the meantime, I'd like to know how stains get there in the first place. Dr. Clarence has agreed to help us find out. He took 5 common beverages with different staining powers and 5 extracted human teeth. He covered half of each tooth in wax so that it would remain unaffected. Then he plopped them into the drinks and we left them for 1 week. What causes staining are molecules called chromogens. On the surface they can be easily brushed off, but when they penetrate further into the tooth, no amount of brushing will remove them.
Clarence, I'm excited about the fact that none of these are my teeth. Let's have a look at them.
What we're interested in is the effect of these beverages on the crown, which is the part of our tooth that is exposed in our mouth. We're starting off with the least damaging, and it's good news for coffee drinkers.
Coffee is not a very effective stainer. It doesn't really have the power to get below the surface of the tooth, so some toothbrushing should do the trick.
The acid in orange juice, however, did eat into the surface of the tooth, which isn't good, but it contained no staining chromogens. Tannins in tea caused more staining than coffee, but cola with its combination of acid and chromogens was far worse.
Cola is a very effective stainer. It has both the 1-2 punch of acid and chromogens, which is essentially color staining molecules. The acid opens up the enamel pores of the tooth, allowing the chromogens to penetrate deeply, resulting in a very, very dark stain.
But cola had nothing on our nastiest teeth stainer, and first place getter, red wine.
Red wine is a triple threat. It contains acid, chromogens, and tannins, giving it the title of most effective stainer.
This looks terrible.
Yeah, it does.
But remember, these teeth were soaked for an entire week. Not a real-life situation. It can take years for stains to build up, and there are many other foods and lifestyle factors that affect staining. So how do teeth whitening products work in removing stains? The peroxide used in teeth whitening penetrate into the middle of the teeth to attack the deep stains.
It will reach the pulp of the tooth within 5 to 15 minutes.
So I can put bleach on my teeth and within 5 to 15 minutes it's right at the centre of my tooth.
Absolutely.
It's amazing.
The peroxides break up the stain into smaller molecules that can't be seen by the eye.
Hydrogen peroxide in my pulp sounds scary.
55 to 75% of patients report some sort of sensitivity, manifested as some sharp shocks in the teeth.
These symptoms are usually temporary. As to whether this causes long-term harm or not hasn't been resolved. More research is required.
There is no evidence to suggest that hydrogen peroxide is cancer-causing, so all good news if you want to brighten up your smile.
Coming up, we'll find out just which teeth whitening product worked the best and reveal the sinister side of mouthwash.
Mouthwash use may also increase the likelihood of getting oral cancer.
For 2 weeks, the boys at Vodafone have been furiously chewing, clamping, brushing, painting and rinsing to put our over-the-counter teeth whitening products to the test. And Clarence is back to reassess their teeth. So, who came up brighter after 2 weeks of teeth whitening? Well, we had a photo finish. Braden and Gary had the most improvement. But when we go to the scoreboard, they only won by a nose. Why was there so little in it? And so little improvement in the whiteness of their teeth?
This could have been either due to the concentration of peroxide or the number of applications, but over time these products will show an effect.
So what about the toothpaste and gum which had no bleaching agent in them at all?
They have abrasives to scrub away the stain. They don't actually penetrate into the tooth to affect color.
Clarence has 3 top tips for choosing an over-the-counter whitener. Number 1, length of application.
Which should be a minimum of about 1 hour each day.
Number 2, concentration of peroxide.
Either a 10% carbamide peroxide or a 3.5% hydrogen peroxide solution.
Number 3, intimacy of fit.
A tight fit is better than a loose fit, so the boil and bite mouthguards are better than the wrap and goes.
So why didn't our mouthpiece work the best?
Everyone's teeth are different. Some people's teeth take longer to lighten than others.
Of course, teeth whitening is purely cosmetic. It's just about looks. But what about products that promise to change more than looks? Have you ever wondered what causes sensitivity in teeth? There are millions of tiny tubes at the base of your tooth, and when the gum recedes, this delicate area is uncovered.
When cold, especially, is exposed to that uninsulated area, the nerve reacts and tells you that you have sensitive teeth.
Toothpastes for sensitive teeth work by the addition of one of three special minerals. The first two are strontium chloride and strontium acetate.
They act almost like corks to fill up those little tubules to prevent the temperature being transmitted to the fluid and the nerve inside the tooth.
The third is potassium nitrate.
The mechanism of potassium nitrate is actually to soothe and calm the nerve of the tooth. It doesn't act as a physical barrier.
These ingredients don't actually fix the problem, but they do help with the pain. However, it might be weeks before you feel any improvement. What about tartar control toothpaste?
Tartar is that rock-hard stuff that forms on your teeth that only a dentist can scrape off. So what can a toothpaste do about that?
Well, it's all about the active ingredient, pyrophosphate.
What the pyrophosphate does is it helps bind up minerals that are in the saliva and prevent the plaque from forming the tartar that we see on our teeth sometimes.
Studies have proved the effectiveness of pyrophosphates in preventing the formation of tartar, but they can't remove what's already there. Some toothpastes seem to promise protection against almost everything for an entire day. How's that? It's all about an antibacterial ingredient, triclosan.
As good a job as we do with our toothbrush and our floss, we're not always able to get to all of the bacteria. So the triclosan help remove additional bacteria.
When this antibacterial agent sticks to our teeth, it continues to kill bacteria long after we've stopped brushing, providing our teeth with an ultimate form of protection. But when triclosan combines with the chlorine in our water, it can form a harmful substance, chloroform, which has been associated with liver damage and may be cancer-causing. Does it form in high enough quantities to be harmful when we brush our teeth? Thankfully, no. Research has shown that the quantities of chloroform formed are well below safe levels.
There's one other reason we clean our teeth: bad breath. And that's something no one likes to talk about.
No one, that is, apart from bacteriologist John Tagg. He's made it his life's mission to study those smelly critters in our mouths and harness their power.
What have you got here in the petri dishes?
This is a Streptococcus salivarius, quite normal, quite
So normal
palatable.
smelling breath.
Normal smelling, yeah.
Yeah, just slightly breathy smelling.
Now we'll try one that was
Yeah.
isolated from someone with rather a bad case of halitosis.
Okay.
If we just say, good morning, bacteria, let's have a little smell.
Oh, that's really, yes.
Dragon's breath extreme, right?
That dish contained the kind of bacteria that feast on the blood that comes from unhealthy gums.
When you open to the world, out comes the odour from those smelly bugs.
Another source of bad breath is the bacteria that dwell in leftover food particles.
And they tend to live deep down in the sludgy layer on your tongue.
Oh, that sounds awesome.
Yeah.
The sludgy layer.
So how do you fix bad breath? Well, plain old boring brushing and flossing is the key. Cleaning away food scraps and keeping your gums healthy. And scraping your tongue will also help. But of course, Professor Tagg recommends his own product, Bliss K12, which contains smell-free bacteria that fight the smelly ones.
It's all good and well talking about bad breath, but how do we tell if we've got it?
You can't go, try to, no, that
can't.
doesn't work
It
because
doesn't
you're
work, does it?
adapted. You're adapted to your own breath. Another way to do it is to actually scrape some of the bacteria from the back of your tongue and then have a little smell of that.
Oh, no.
But the best method might be the most obvious one. Ask a friend to give you an honest assessment.
Ask them, is this pooey?
That's two tests in one. A test of real friendship and a test of breath.
Of course, there's always mouthwash. In the Royal Dental Hospital of Melbourne is an associate professor who believes we need to be warned of the dangers of mouthwash.
problem with the mouthwash is its possible association with the increased likelihood of getting oral cancer.
This is because most mouthwashes contain alcohol, and the amount can range from 6% to as high as 27%.
Alcohol in the mouth is broken down into its first breakdown product, acetaldehyde, and acetaldehyde is a known carcinogen.
And the way we use this highly alcoholic solution adds to the problem.
The length of time that the alcohol's in your mouth and number of times it's repeated during the day means that you're more likely to get higher levels of acetaldehyde in your mouth, which increases the likelihood of getting oral cancer.
As much as 5 times, and for smokers, the news is even worse.
Smoking and mouthwash together increases your likelihood of getting oral cancer by about 15 times as much.
This multiplication of risk may be because the alcohol strips the mouth of its protective saliva, even thins the skin.
Alcohol makes the skin inside your mouth more vulnerable to the cancer-causing chemicals that are present in the cigarette smoke.
But not everyone agrees.
A careful review of all the literature shows that alcohol content in mouthwash, when used appropriately, is not a significant risk factor for any forms of oral cancer.
And even the American Dental Association conclude the evidence isn't strong enough to draw a link.
This is a fairly contentious issue, and rather than wait for that evidence to be proved in 5-10 years' time, myself and colleagues think it's worth sounding that warning early.
So should we be using mouthwashes at all?
If you've just had some sort of surgery in your mouth, then it is well shown that certain types of mouthwash do help the recovery from that.
But this would mean using mouthwash for just a few weeks.
It's not, here, use this mouthwash long term for the next 20-30 years of your life.
If you're concerned, there are some alcohol-free mouthwashes available.
So what have I learned? In our house, mouthwash will be alcohol-free and reserved for an only when needed basis. We'll be choosing toothbrushes with soft bristles and a toothpaste with fluoride. I'll be supervising the children brushing and encouraging them to spit. Don't think we'll have too many problems there.
Hair dyeing, the more you do it, the greater the risks. We've found products on our shelves that shouldn't be there. They're illegal because they contain banned chemicals. So are we safe? What's really in our hair dye?
We use dyes to colour our hair. It's all about wanting to look good, to feel more attractive. It's about wanting to stand out from the crowd. But what is in all of this stuff? Is it safe to use on our bodies? Or are we putting vanity ahead of our health?
First, I want to find out just how popular hair dyeing is.
Have you ever had your hair coloured?
Yes, I have.
Yes!
No.
No!
No.
No, never?
Never.
Yeah.
Yes, I have.
Good man! Any colour in particular?
Dark red.
Oh yeah. There you go. This is working for you, the blonde. I like it.
I love blonde because blondes have more fun. Do you agree?
Yeah, I reckon.
More than half of all women dye their hair every year, and 5% of men. And most often it's done with a permanent hair dye. To find out what's in permanent hair dyes, I'm meeting Professor Margaret Brimble, Head of Chemistry at Auckland University.
Well, there's basically 3 main components in hair dyes. First of all, you've got ammonia.
Ammonia is used to open up the cuticle, the hard outer layer on each strand of hair, allowing other chemicals to penetrate the hair. But ammonia is a disinfectant commonly used in household cleaning products, and some hair dyes make a big thing of being ammonia-free. So should I be worried if ammonia is in my hair dye?
I really don't think ammonia is a problem. You don't go breathing your floor cleaners. The same thing with your hair dye. Just don't inhale them.
And besides, without ammonia, it's likely that a very similar chemical like ethanolamine is used instead to do the same job. The second main component in most permanent hair dyes is hydrogen peroxide.
Clearly hydrogen peroxide, I wouldn't put it on my skin directly, I wouldn't eat or drink it, but certainly the concentration of hydrogen peroxide that's in hair dyes would not concern me.
Hydrogen peroxide is a bleach. It gets into the hair and destroys the melanin, the natural pigment that gives us our natural hair colour. Our melanin comes in two types, brown and red. Combinations of these two pigments make up every single colour of hair found in humans, even blondes, who simply have less melanin. So once the bleach in hair dyes destroys our natural pigment, the dye building blocks can do their work. They're the third chemical component in a permanent hair dye.
And they simply react with the hydrogen peroxide and they form the dyes.
There is one group that we should be concerned about. There are various phenylenediamines, but one of the most commonly used is paraphenylenediamine, also known as PPD. It's often in both home and salon dyes.
PPD is a derivative of coal tar. It's got a very dark colour and so it will stand up to all the conditions that your hair is exposed to and without losing the colour for long periods of time.
PPD is a highly effective colourant, found even in lighter shades of hair dye, but it has been investigated as a carcinogen. To date, the World Health Organization has listed PPD's carcinogenicity to humans as not classifiable because there hasn't been enough research done.
Several regulatory agencies are looking into the effects of PPD in combination with hydrogen peroxide and whether this combination can lead to compounds that cause cancer.
While it's not clear if PPD is carcinogenic, it can cause another kind of health problem.
That's about where it started from anyway.
Last year, Paul Spry suffered a severe allergic reaction after he had his hair dyed black at an Invercargill hairdresser. Paul's reaction had all the hallmarks of an extreme PPD reaction. It began with an unrelenting, itchy scalp.
If you'd have given me a blunt spoon right then and there, I would have scalped myself. The want to just get in and just rip it out of your head was honestly there.
Paul only had the hair on his head dyed, but the reaction caused his head to swell and a rash to spread out all over his body. Then he began to seep fluid.
2 days later, I woke up and it was pretty obvious that things were pear-shaped, I suppose. My pillows, sheets, they're all black. I'd had black dye leaking out of my head. Things were leaking out of open wounds that had opened up overnight.
Paul wishes he'd told his hairdresser to stop applying the dye as soon as his scalp began tingling. Instead, he endured 2 weeks, battling a reaction he felt he couldn't control.
I was going to bed with my husband with one symptom and then waking up the next morning, he looked totally different. The transformation was, it was so scary.
So what could have caused a reaction like this?
PPD is attracted to the protein keratin, which is present in our hair. But the problem is that keratin is also present in our skin.
The reaction varies from a mild itchy scalp that can progressively get worse, going down the hairline, onto their eyelids, down the neck, and in a most extreme case, you can have someone needing admission to hospital because the face is so swollen, and very rarely they can die from anaphylactic reaction to PPD.
It's important to emphasise we've found no reported deaths related to PPD in New Zealand and only one related death in the US. Extreme reactions like Paul Spry's are rare. It took 4 months for his hair to start growing normally again. These days, dyeing his hair is not an option. He just gets a cut at the barber.
So any more colour for you?
No, mate, she's going to go grey gracefully with it. Just the haircut, man.
So what are my chances of a PPD reaction, even in a mild form?
Unfortunately, no one really knows because the hair industry doesn't monitor PPD reactions, overseas or here. We asked the New Zealand Cosmetic Toiletry and Fragrance Association, which represents almost all hair dye suppliers, why not?
As an industry, we would not support putting that tracking system in simply because of the logistics and the cost of trying to do that.
Despite there being no solid data, it's estimated that around 3% of us are allergic to PPD.
Have you ever had a reaction to having hair colour?
No, never.
It burned quite a bit. It was quite painful for a while.
Have you ever had a reaction to hair dye?
No, or only when I get it coloured with my chemical dye, it only burns.
That doesn't put you off colouring your hair?
No, beauty is pain. No allergic reactions to any hair colour.
Well, that's good news.
Or is it? If you haven't had an allergic reaction to hair dye before, you're safe, right? Well, no.
If you use PPD for long enough, almost everyone is at risk of becoming allergic to it.
That's because PPD is what's known as a sensitizer, a substance that you become increasingly sensitive to every time you're exposed to it, because the body remembers it.
PPD is one of the strongest sensitizers known to man.
Well, that leaves me in a tricky spot, doesn't it? So far, I've never had a reaction to hair dyes, but it doesn't mean I won't develop one.
After the break, how can I get my hair dyed without risk of reaction? And we find banned ingredients in our hair dye products.
I'm absolutely shocked that you can still get products that contain lead acetate.
Remember, permanent hair dyes can contain PPD, which can cause severe allergic reactions in some people when it makes contact with the scalp.
The want to just get in and just rip it out of your head was honestly there.
PPD is also a sensitising chemical, meaning repeated exposure can cause any one of us to become allergic to it.
So how can I be sure I'm not going to react next time I get my hair dyed?
Hairdressers are trained to firstly do patch testing, so they know what to look for in terms of any potential reaction with the consumer.
I have to admit I've never done a patch test. In fact, I didn't even know they were available. So what exactly is a patch test?
A patch test is where you actually take the colour that you're going to use and you apply a small bit to either behind the ear or in the crook of the elbow. If there's no sensitisation or irritation or anything of that matter, then it's quite safe to proceed.
Can you do a patch test on me?
Yes, I can. I'll just get a little bit of the colour we're using on Leslie.
Yep.
Just a tiny little bit. And we're going to apply it just into this area in here.
If I had a reaction, what would I potentially see?
Well, within a couple of hours or so, you would notice that it would be a red patch and maybe sore and itchy.
I'll keep you posted.
It means 2 trips to the hairdressers, one for the test and then if it's okay, back for the colour.
So when can the trouble start?
People are a little bit too slap happy with their application, I think, and they get it all over the skin and they come down too far below the hairline. That's when they start to cause irritation, and then they try and wipe it off, so they're using something quite strong to wipe it off and the skin gets red.
The rule is keep it off the skin as much as possible. If you're doing it at home, get someone else to help and always wear gloves. In New Zealand, permanent hair dyes aren't allowed to contain more than 6% PPD. For people wanting to avoid PPD, there are products that use other dye building blocks, like resorcinol and p-aminophenol. Some of these other dye building blocks are still being investigated, and the dyes therein also recommend doing a patch test to check for sensitivity. There are semi-permanent hair dyes that don't have PPD. It pays to check though. And semi-permanent dyes are just that. They only coat the outside of the hair and they eventually wash off. What about natural dyes like henna, a natural plant pigment? Not much research has been done on henna, however, there is some suggestion that it may be a weak sensitizer. Also, there are other products advertised as henna, like black henna, which contain the stronger sensitizer, PPD. And other hair dyes with natural sounding names aren't necessarily PPD-free either. Both of these products contain paraphenylene diamines. You don't have to look hard to find PPD in a lot of hair dyes.
PPD's been around for 100 years. It's probably still going to be around for a long time yet, until someone comes up with a better substitute.
Time to check on my patch test. Nothing. So that means I'm currently not sensitised to PPD, but I'll have to do the test regularly
if I want to reduce my risk of a reaction. Our hair is forever changing. We can be born blonde only for it to get darker. That's our hormones changing as we grow up, especially during puberty. Then as we grow older, we produce less melanin in our hair and we slowly turn grey. Can you really go grey overnight?
Fact or fiction? The stories of people suddenly going grey overnight are not true. Only new hair can start growing as grey. Existing hair cannot suddenly change. Phew, she's looking hot for an old duck.
While the use of hair dye is increasing among men, it's the onset of grey hair that sees many reaching for the bottle.
Lots of men are having their hair done and dyed, More so than ever.
I think grey is very sophisticated on me.
Yeah, well, I would go for a silver fox. You look at them twice.
Do women really like grey hair? I'm going to find out. We've asked the digital retoucher to transform our model into a bona fide silver fox for our punters on the street to decide.
Which do you find more attractive, the grey hair or the brown hair?
Ooh, I'm going to have to go with the brown hair.
The brown hair.
The brown hair. Which do you find more attractive?
This one.
Do you?
I do.
No, tell me why. Tell me why.
It's more natural.
The grey?
I like grey hair.
Yeah, so do I.
Yeah, it's sexy.
Do you like silver hair on fellas?
George Clooney.
Hello, sir.
Yes.
Oh, that's gorgeous both ways, isn't he?
Which one would you prefer to sit down and have a cup of tea with? Brown!
Overall, twice as many women preferred the brown hair. It helps to explain why there are numerous hair dyes available for Kiwi blokes containing the same basic chemical as hair dyes for women. However, in these 3 hair dyes, we found a chemical we didn't expect to find: lead acetate.
I'm absolutely shocked that you can still get products that contain lead acetate.
These products were made by a large American company, Coom International. Lead acetate is permissible in the US and in Australia, but it has been banned by the European Union, and New Zealand has followed its lead. Lead acetate has been classified as toxic to reproduction and may cause harm to an unborn child.
All products that contain lead acetate should have been banned, whether that's in cosmetics, paints or hair dyes. The consumer should be protected from that.
Lead acetate was banned in New Zealand in 2006 by the Environmental Risk Management Authority, IRMA, yet these products containing it were still easy to find.
I certainly wouldn't go anywhere near hair products that had lead acetate in them.
After the break, we find out who's responsible for policing these products, and we discover more that shouldn't be available. Eyebrow and eyelash dyes use very similar chemistry to permanent hair dyes, but should we be using these chemicals on eyelashes, which are so close to our eyes? According to Professor Charles McGee, the cornea itself is 40 times more sensitive than the tip of your finger.
The eye, once you go onto the surface of the eye, it's clear, there's a very thin tear film, but it doesn't have that same thickness or toughness that the skin has. It doesn't have blood vessels to draw away any chemicals, so the chemicals have a much more severe effect.
Especially hydrogen peroxide.
It's absolutely essential you don't get hydrogen peroxide in your eye. Some people say it's among the worst pains they've ever had, and they can't open their eye, and they can't speak, and they're crying.
The products we found available on New Zealand shelves contained only 3% hydrogen peroxide. But even at that level, if you get too much of the solution on your eye, it can temporarily damage the surface.
It makes the surface almost go like ground glass or frosted glass for a day or two. And in those cases, the vision is reduced a lot.
The US Food and Drug Administration is strongly against the practice, warning it could make you go blind. Our local industry is especially concerned about eyelash dyeing.
Dyeing of eyelashes is not something we support, and from a New Zealand perspective, we should err on the side of safety, and dyeing eyelashes is not a safe practice.
But the risk doesn't come from just hydrogen peroxide. This product contains p-phenylenediamine, or PPD, the sensitising chemical common in permanent hair dyes. According to the Environmental Risk Management Authority, IRMA, home kit eyelash dyes must not contain PPD. Only eyelash dyes in beauty salons can.
If you get it around the skin of your lids, because the lid skin is relatively thin, it swells more easily, it cracks more easily. It's generally worse around the eyes than it is, say, in your scalp or your hands.
So we were able to buy an eyelash dye that shouldn't be sold in New Zealand because it contains PPD. And it wasn't a one-off purchase. We found this product in a large department store and 4 pharmacy chains. What's even more concerning is this eyelash dye also contains metaphenylenediamine, also known as M-phenylenediamine. Metaphenylenediamine is another dye building block, similar to PPD but potentially more harmful. It's also in this other Grecian product for men's grey hair.
Metaphenylenediamine has been banned by the EU I'm very concerned that you've been able to find metaphenyldiamine in a cosmetic product here on our shelves in New Zealand.
There should not be any product containing M-phenyldiamine in New Zealand on the shelves at all.
Nor should the 3 packs of hair dye containing lead acetate be on our shelves. So how is it New Zealanders can buy these products and use them? Shouldn't someone be stopping the sale of these products containing banned chemicals?
Ultimately, the responsibility falls on the Ministry of Health, but it relies heavily on the industry to monitor itself. Importers and retailers are expected to notify the authorities if they become aware that any product they import or sell contains a banned chemical.
Likewise, the Cosmetic, Toiletry and Fragrance Association should act if it hears of a product containing a banned ingredient, like M-phenyldiamine.
If a product was found to contain that ingredient, we would immediately insist that the Ministry of Health take action to withdraw the product in the first instance and seriously look at prosecution.
But who's checking up on the importers? The Ministry of Health says there is no system for conducting regular checks of possibly non-compliant products. It often learns about a potential risk through a complaint by a member of the public. But remember, we found products containing banned chemicals in Kmart and popular pharmacy chains. So why didn't these retailers report them?
Kmart sincerely regrets that this matter was not detected earlier.
The products have been on sale in New Zealand for many years, and neither we nor the suppliers were aware of changes that made them illegal in New Zealand.
We did not know about the issue of the banned substances.
Each of the products is supplied from Australia and permitted in that market.
Unfortunately, this matter serves as a good reminder that the business and its suppliers are not immune to oversights.
Our own eyes are our last defence for the more than 170 hair dye chemicals that have been banned. But how many of us know what to look for?
Have a go at saying that chemical there.
Phenylamine.
Aminopropyl.
Yeah.
Resorcinol. Phenylenediamine. Phenylenediamine.
It's hydroxindole.
Very good. Do you have any idea if that's a safe chemical or not?
I've got no idea what it is.
Would you know if any of those chemicals were a health risk?
I wouldn't have the foggiest.
Would that be a health risk, do you reckon?
Anything if spelled like that or pronounced like that would be a health risk.
You reckon pretty much all of that's a health risk?
It must be.
Understanding these chemicals is made impossible if there's no labelling at all. We purchase these hair dyes in discount stores. One is in Japanese, the other doesn't list ingredients at all. According to Irma, all hair dyes must display ingredients in English.
Any product that is not labelled is illegal.
It's not just against the law, it's dangerous. And it's not only in discount stores that we found incorrect labelling. On the box of this Grecian product, it specifies this concentration of lead acetate. But look on the tube inside and it reveals an amount more than 3 times higher. Remember, lead acetate is banned, yet we found this product in 3 pharmacy chains.
In an ideal world, I think it should be fully policed, the public should be well informed, and these products shouldn't be on our shelves.
The apparent lack of control around these products is so alarming that we took it up with the Ministry of Health.
The Ministry of Health is certainly concerned that cosmetic products containing banned substances are being sold on the New Zealand market. The Ministry is currently working with Irma and District Health Board public health units to develop an action plan that may include proactive monitoring activity.
So what have I learnt? If you're concerned about reactions, get a patch test done before you dye your hair. It could save you from a nasty experience. I'm shocked to discover there are banned chemicals out there on our shelves. We're not as protected as I thought, and it's not good enough.
It took our research to discover products containing banned substances being sold here. And the retailers responded by removing the products from sale and issuing product recall notices.
I'm challenging the authorities responsible for policing these products to do more to protect us.